I'm Dr. Heather Thieme. I'm a surgical oncologist, which means I specialize in cancer care. And my specialty within that is breast surgery. And that includes not only breast cancer, but other conditions of the breast. So I chose to go into this because I enjoy helping people. I'm interested in the science behind what we do and improving the quality of people's lives. Signs and symptoms of breast cancer most commonly are feeling a lump in the breast, and usually this is not a painful lump, but any lump should be investigated further, either with imaging or with biopsy or both. Other symptoms could be bloody nipple discharges or changes in the skin that weren't there before. Well, ideally, we want to find breast cancer before there's signs and symptoms, because signs and symptoms implies that the cancer is advanced enough to have found it. And the way we find it before there would be a sign or symptom is to do imaging, most notably mammograms, which we recommend every year after a woman turns 40. Some of the imaging that we have available through our Women's Imaging Center are not only the standard 3D mammograms, but also breast MRI, ultrasound, and also contrast mammograms. Contrast mammograms are not widely available elsewhere and can be very helpful when patients are not tolerant of breast MRI. For treatments of breast cancer, one of the opportunities that we have that is also not widely available is plastic surgeons that specialize in flaps, where we use the patient's native tissue to reconstruct the breast rather than using a foreign object such as an implant. Breast care is always a multidisciplinary effort, and what I mean by that is that there are teams of specialists that help the patient get through their treatments. Typically, that'll include not only a breast surgeon, but also a medical oncologist, radiation oncologist, plastic surgeons. So it's important that each aspect of that team is communicating and coordinating. And we have nurse navigators that help those patients as they're figuring out what those appointments are and when they need to be there, because otherwise it's a very complicated process to suddenly find yourself in.